Hello everyone, my name is Sanjana and I'm studying in first year MBBS of HYOID Medical College. Today I'll be speaking about HYOID bone. HYOID bone is a U-shaped bone present between the chin and the thyroid cartilage. As you can see in this image, this is the thyroid cartilage and this is the chin area. HYOID bone is present over here. The unique feature of HYOID bone is most of the other bones have 2 or 3 ossification centers, while HYOID bone has 6 ossification centers. Now, the HYOID bone provides attachment to the floor of the mouth and to the tongue above, to the larynx below, and to the epiglottis and the pharynx behind. Let's talk about the parts of the HYOID bone. There are totally 3 parts of the HYOID bone. The main body, a pair of greater conva or the greater horn, a pair of lesser conva or the lesser horn. Now, let's talk about the body. Now, the body has 2 surfaces, anterior, posterior, and 2 borders, that is upper and lower. This is the anterior surface and behind is the posterior. This is the upper border and this is the lower border. The anterior surface is convex and is directed forwards and upwards. And the posterior surface is concave and is directed backwards and downwards. Each lateral end of the body of the HYOID bone extends backwards and continues with the greater conva. Now, talking about the greater conva, the red marked area is the greater conva or the greater horn. Now, it is flattened from downwards. It has 2 surfaces, upper and lower, and 2 borders, medial and lateral, and also a tubercle. Lesser conva is the yellow shaded area. These are 2 small conical pieces. The lesser conva are connected to the body by fibrous tissue. Occasionally, they are connected to the greater conva by synovial joints, which usually persist throughout the life. Let's talk about the attachment of the HYOID bone. Now, to the anterior surface of the body, it provides insertion to genohyoid and mylohyoid and origin to hyoglossus. This is the anterior surface. Here is the insertion of genohyoid and mylohyoid muscles. Now, to the upper border of the body provides insertion to genoglossus. The lower border of the body provides attachment to the pretracheal fascia and provides insertion to sternohyoid and superior belly of omohyoid. This is the sternohyoid muscle which is present over here, and this is the superior belly of the omohyoid which are inserted at the lower border of the body. At the medial border of the greater conva, there is insertion of stylohyoid muscle and the digastric pulley. Here you can see the stylohyoid muscle and this is the digastric pulley. These 2 are inserted at the medial border of the greater conva. The lateral border of the greater conva provides insertion to thyrohyoid muscle, which is present over here, thyrohyoid muscle. This is inserted at the lateral border of the greater conva. The lesser conva provides attachment to stylohyoid ligament. Coming to the development, here, the upper part of the body and the lesser conva both develop from the second brachial arch, and the lower part of the body and the greater conva develop from the third arch. Speaking about clinical anatomy, fractures of HYOID bone are very common in throttling and strangulation, and when the neck is relaxed, palpation of greater conva of the HYOID bone can be seen. Thank you.